Hi, my name is Danielle Matias, and I'm a PA here at Caring Medical Florida, and I want to talk about rotator cuff tears and healing with PRP. If you're sitting like this, like if you're just kind of hanging out, like not really using your shoulder, it's probably not too bad, but when you go to, do your hair or do anything where you're lifting your arm, it can be pretty symptomatic, pretty sharp pain. The supraspinatus tendon is the rotator cuff tendon specifically we're going to talk about in this case. It also is the most commonly torn rotator cuff tendon, so it's pretty fitting. This patient was a 62-year-old male. He worked as a ground support technician, so working with a lot of heavy equipment. And this was his initial ultrasound exam in April. So just to orient you, this bottom white line here, this is bone, okay? This kind of tire on a rim, that's the supraspinatus tendon. Again, that's a rotator cuff tendon. Tendons attach muscle to bone. So this is the supraspinatus muscle attachment to the bone. On top here, this is muscle. So this is really what we're looking at right in here. Several things I want to point out. So in this tendon, a normal healthy rotator cuff tendon should be these kind of like bright white striations throughout the whole thing. When you see these like gray, black pockets, that is evidence of what we call tendinosis or tendon degeneration. This white line that you see right there, you guys are all getting a crash course in ultrasound today, that's called a cartilage interface sign, which is indicative of a tear, all right? And up in here, this kind of black line, that is the bursa that sits right on top of the tendon. So real quick, a bursa, just like a small fluid-filled sac that sits on top of here, helps just kind of to reduce friction. Really, like we shouldn't see much of that, but it is common in someone with a rotator cuff tear or even tendon degeneration to have increased bursal fluid, which really then adds to more of the pain and dysfunction. Now, we treated this patient twice with dextrose prolotherapy and PRP. PRP stands for platelet-rich plasma, which is essentially where we draw your blood, we concentrate the growth factors out of it, and then we inject it like directly into injured tendons or ligaments or joints for healing. And we had confirmed, yes, these are the big pain generators in the joint because we had done diagnostic blocks where I took a numbing agent, I injected it into the tendon, into the bursa, and the patient's pain got a lot better. He had a lot better range of motion with less pain. Does a diagnostic block fix the problem? No, the numbing eventually wears off, but it just confirms to us, yes, these are the structures we need to strengthen. After 2 treatments, if he's not feeling better, we talk a lot about activity. Are you doing too much? Are we needing to take a step back with activity, rehab, and so forth? So we made some changes. When this patient came for his 4th visit, so after he had had 3 treatments, he had turned a quarter. And this is his ultrasound. So just, this is again in August. You can see how we have a lot more white in the tendon, right? Like again, this is the bone. This tire on a rim is a supraspinatus tendon. It's a lot more white. We're not seeing that bursal fluid like we saw last time, right? Like his bursa had calmed down. Is it perfect? No. We still see this cartilage interface sign. We still have, more of that tear to fill in, but we're trending in the right direction, which is what I want to see. And the patient is starting to feel better. Now, if I had it my way, I would love it. If everyone, we treat them one time and then they're golden, that would be fantastic. It's not the reality, right? Healing is not something that just happens overnight, especially if the injury is chronic. Healing is not linear. It's not that every day you're going to wake up and it's better than the day before. Typically, it's kind of up and down, right? You might have like some good days, bad days. I oftentimes compare it to a roller coaster. But recently I've heard someone compare it to the stock market. Things might be up and down, but as long as we trend upward, everyone's happy. Another point I wanted to make, just because this patient had asked me this, you're never too old to heal from prolotherapy. Okay, patients ask, oh, I'm 62, am I just never going to heal? I said, well, if you got a paper cut, are you going to have the paper cut for the rest of your life? No, your body is still capable of healing at any age.